You don't have to do that bilaterally? Yeah.
You would, well, you would, yeah, so I'm in the interest of time. But
Yeah.
yes, in all these tests, you do them bilaterally. Why? Because you
I
want to make
wasn't sure
comparisons.
because you're putting one arm in one position, and you're getting that information
Right.
from that lens.
And I would do it bilaterally because if she had a unilateral insult in her brain, for example, she may be impaired on this side, but when I put this hand in a certain position, she can read it and mirror it over here just fine. So it may be a more of a fine motor control issue versus a math issue, so I don't know. But yeah, I would do both sides.
I think the other thing that's really important is, Christina's alluded to this a little bit, use of hands intrinsics. And often patients will not have an occupational therapy referral. And it's not that we want to generate a referral and it's not needed, of course not, but if they're having a hard time with those smaller muscles of the hand, the coordination of the wrist, that could be a need for an occupational therapy referral. And I've seen this too often in the SNF that PT speech and OT is left out. And I see oftentimes the need for OT, talk to the PT and generate an OT referral by talking to the physician. Yeah, so really watch for the small things with the hand, really important, because you can imagine how useful that is. And OTs are real specialized in it. PTs are good with the hands, but I think OTs, a lot of certified hand therapists are quite excellent.
Yeah, I would agree with that. So now we'll look at kind of some coordination tests, and this is where you would have to modify it depending on their motor function, but you have to hold your arms out like this, close your eyes, bring your right index finger to your nose. I know, we talked about this. Okay, and your left index finger to your nose. Okay. Any difference between right and left? Okay. Can you do it on the right again? Now this is a test as you repeat it, they practice and they learn, so it's not as reliable as the first go around. Go ahead.
Right again.
Left side. Okay, a little bit better that time, right? Because you got some input, was able to do some error correction. You can relax your arms. Okay, so a little bit of impairment there, and then you'll see finger to therapist finger. So you'll see, having people kind of reach and be able to do this type of thing. So can you touch my finger? Good. Touch your nose.
Just
Finger, nose. So when she's got vision, she's doing pretty good, right? When she doesn't have vision, it's a little bit off. So she can do that type of thing. Let's see if I missed anything. Did I miss anything? I gotta do gait and standing.
Yeah,
Make sure we do that. All right, so now I'm ready to have her stand, right? So I have a pretty good sense of what she's gonna look like. Now as PTAs, you'll have this in the evaluation. So don't expect to have to start from lying down, then go to sitting, then coming up. You'll read these evaluations and you'll see that she's independent in sitting. She's independent with static and dynamic sitting balance, and you'll read that in the eval. So unless you need or have been asked to look at that tone again, or your intervention is around looking at that in supine, or I've asked you to work on a functional mobility activity on the mat, or some stretching for tone inhibition, you don't have to go through this process from lying down to sitting. This is part of the initial assessment. You'll read that level of assist and say, wow, Karen's independent in sitting. I'm going to be able to work in standing right away after I check vital signs. Because she can respond relatively quickly. She has some minor proprioceptive impairments. She's otherwise independent, so I can go. So you're not going to have to go through this process that I just demonstrated. This is the evaluative process. Does that make sense? I shouldn't say does that make sense, because if it doesn't, I got to work on that. I had a lady observe me teaching once. She said, stop saying that.
And do you think Christina was observing cranial nerve function during her eval?
Oh, there we go. Thank you.
That's the piece.
Right.
Yeah, absolutely. And she's watching eye movement, she's watching breathing, those communication pieces. So
Right. So swallow function,
swallowing,
looking at IVs,
facial
preference.
muscles. She was smiling a lot, like those facial muscles.
Yeah.
were in good shape.
Good facial symmetry, right?
Yeah.
Thank you for reminding me of that. Yeah. So in the eval, I wouldn't necessarily formally test that. I would just say they're all pretty
I do.
normal. Okay, you want to stand up for me? Yes. Okay. Okay. Go ahead and sit back down. Can you try that again? Good. One more time. How does she stand up? Okay. A little bit of bracing on this leg against the table. Just a little bit. Scoot your bottom forward. Can you scoot your bottom forward? Yeah, try it again. A little bit different. Okay. Take the table away so we know a little bit about her trunk, right? And a little bit of maybe what sort of compression forces are happening in the lumbar spine. something as an orthopedic therapist, I might be seeing her for back pain at some point, right? Okay, so standing, I've got the gait belt on just to reinforce the safety piece. In your institution, wherever you work, we'll have different rules about gait belts, but we'll just do it here. And again, I've got my hand on her. Let's turn around slowly. Okay. Now I've got my hand on the gait belt, so I'm not gripping, right? Because I don't need to. But I've got my hand on the gait belt, but I've also got my hands on her trunk, because this is where I'm going to feel if she's moving away from me, right? So I can immediately pull her into me if I need to. I've also got this hand free. Go.
When you get observed with the turning, just watch how she's turning.
So I can do like this, okay? So I've got her right here, and then I can just have her move with me a little bit. And I can talk with her about this and say, we're just going to do a little shifting, and I can go forward and back and get a sense of where her cone of stability is, right? And we're going right together, and we can do lots of fun stuff. This feels pretty good. I'm pretty confident that she can stand up nicely. You can do nudge tests. I let go of her trunk. See, I was facilitating it. I snuck it in there. As soon as I let go of the gait belt, she goes backwards, because just having my hand on her and my sense of where midline is, I'm actually propping her over the middle of her feet a little bit, because I feel that this feels like upright. And as soon as I let her go, she goes back. So this is something I'm going to keep my hand on. Okay. So you can do nudge tests. You can do the same finger to nose and standing. You can do the same reaching, both going across midline and forward. Okay, I'm going to have you close your eyes. I'm not taking my hand off her, right? And you may need to remind your patients of this. I'm going to ask you to close your eyes, but I'm going to be right here, right? And then you can slowly take the hand off, but you've got it. Open your eyes for me. I'm going to turn to the side. Yeah. Okay. Go ahead and close your eyes again. So if I'm going to check without, I'm going to just kind of check that, right? So I'm right here, right here. Okay? Go ahead and turn this way. Okay, ready? And can you reach your arm over your head? Yep, good. Both arms? Can you give yourself a hug? Good. Can you reach this way? Can you look at your hand while you... Okay, turn. Okay, can you turn and look this way? Okay, so we're doing a little bit of standing weight up. That looks okay, right? You stand with your feet together so they touch one another. You'll see a term like Romberg or sharpened Romberg, right? Feet together, decreasing your base of support makes it harder to stand. How about heel toe? How about heel toe?
Heel toe is not good unless I'm hanging up.
Let's come out here. Here, ready?
You see all this is treatment related to?
Yeah.
She's treating.
I can't help it.
Yeah, I know, it's good.
It's
I think
good
that's
this
really
way.
important when you're documenting.
Okay, here we go.
Okay.
That's testing, but it's also treatment.
So not only do I watch if she can do it, but I watch how she initiates it. What are her strategies to get all of her weight on one side of her body and advance a limb? What are her strategies? Yeah, so what is she, what area of her body is she calling upon to really do a weight shift? Her trunk, right? Her trunk is really where she's seeking stability, right? Because she doesn't maybe have good control or information coming from the leg, right? So am I going to time her to see how long she can do this? No, I'm not going to do that, right? I would just say that she needs assist or is unable. I would say assist, really. Okay, go ahead and put your feet together again. All right, you close your eyes. Okay. And then you'd be counting, right? Looking for 10 or 30 seconds, so you would see that document. I like to go to 30.
These are all elements in a bird test too, if you're ever asking for a bird.
Yep. Go ahead and open up your feet. You can open your eyes. Can you come up on your toes? Okay.
Not very good.
Okay. And how do you strength test the calf? Right. Oops. Weight bearing. Right. Can you squat? Good. Yep. All right. You want to do that again? Okay. Any strategies that you see? Yeah, the hands start to come here, right? Because you need your trunk, right? And then we're getting a little bit of weakness there. And a little nervous giggle, right? This is a little scary. I'm not so sure about it, right?
I don't mind falling on the floor.
No F words. No F words.
I like that.
All right, so you come